You know, when it comes to pregnancy, it is really important for women to take care of their physical health, obviously. But it is equally important to take care of the mental health as well. And here with more on that is Marissa Abrahams from the Overlake Childbirth Center. Welcome to New Day. This is something that I am so passionate about. I struggled in my pregnancy, and I didn't even really know that was a thing. Everyone talks about postpartum, but they don't talk about before, during.
Yeah.
So what is a psychiatric nurse practitioner's role in obstetric care at Overlake Childbirth Center?
Yeah, well, first off, I just want to say Happy Mother's Day. And I'm
Oh,
glad to be here.
Yes, to you as well.
Thank you. Glad to be here for Maternal Mental Health Month,
Yes.
representing Overlake. Yeah, I mean, you know, maternal mental health complications, perinatal mental health complications are one of the leading complications in pregnancy, one of the least recognized and undertreated, particularly in underserved communities.
Yeah.
So there's kind of a growing movement to integrate mental health care within obstetric care to kind of ease access and expand access. So that's my role within Overlake. I'm embedded within the OBGYN department to work with people who are pregnant, who are postpartum, up to a year, really to try and get them the care that they need where they need it.
God bless you. I mean, it's actually life-saving. I will say, it is life-saving stuff you're doing.
Yeah.
What are some of the common signs and symptoms of mental health issues, and what are how common are these conditions during the pregnancy?
Yeah, these conditions are extremely common, and I think this is like a common misconception that, you know, we just kind of think of pregnancy as like a protective time for mental health.
Right.
And we kind of find more and more that that's not necessarily the case.
Yeah.
Once in a while we can get that, and that's great. But for many, you know, people can start to have symptoms of perinatal depression, anxiety during pregnancy, you know, commonly in the first 3 months, but really up to a year postpartum also.
Yeah.
So in depression, we're looking for changes in mood, persistently lowered mood, sadness, inability to experience joy or pleasure, right? Difficulty sleeping when you get a chance to sleep, right? So baby sleeping, you're not able to.
Right.
You know, changes in appetite, changes in energy, changes in interest and motivation, and sometimes, you know, pretty serious symptoms like thoughts about not wanting to be alive or wanting to end your life.
Yeah.
And sometimes we see more kind of very significant anxiety symptoms where people have a, you know, heightened sense of threat and arousal and a lot of worries that are difficult to control, even scary thoughts about hurting themselves or hurting baby that are not connected to anything they want to do, but are driven by anxiety.
Anxiety, hormones, all these things. For me, it was hard because, like, you know, when you're pregnant, everyone's like, you're supposed to be so happy. It's a beautiful time. She's glowing.
Yeah.
For my second, I didn't feel that. I had just gotten a new job here at King 5. I was scared, and I wasn't expecting any of this. And I thought that whole misnomer, I thought I couldn't tell people that I was unhappy.
Right. Well, and this is something that I see really commonly in my position is just this high level of shame and guilt around these symptoms. And that also can be a symptom, and that's something to recognize, and where I hope that we're kind of making steps towards decreasing the stigma around perinatal mental health issues, because they're so common and it's not something that anyone chooses.
I wish I knew you then. Wait, so how can people get to know you and access services?
Yeah, absolutely. So my role specifically is embedded at Overlake, so I'm within their OBGYN department. So for any patient of Overlake OBGYN, if they're pregnant, postpartum, up to a year, you can speak with your OBGYN, you can speak with your obstetric nurse about getting a referral if you're concerned about symptoms, or if you've had a history of mood issues with anxiety prior to pregnancy. Sometimes that can be a time during pregnancy that it's worthwhile to address some of those things and get a bit of a jump on things.
Yeah, so okay, so let's go postpartum. Let's talk about this. You know, just kind of walk us through what someone can expect. Like, what are the mental health services available for parent and baby care center once the patient has gotten their referral from OB?
Absolutely. So my role as a nurse practitioner is I'm primarily doing consultation appointments, but really we're just kind of like getting the, you know, we're talking about what's happening and thinking about what tools might be relevant. So for some that can include medication. There are many options that are safe, compatible with pregnancy and lactation. For some that includes kind of targeted psychotherapies, and then I can provide referrals and referrals to other services. We talk about lifestyle, we talk about exercise and diet and light exposure and, you know, access to supports, use of supports.
Yeah, I mean, I just, like, as a woman, a mom who went through that, it's like just everything you're saying is like a huge weight off my chest. And I hope that if you're out there, or if you know somebody who's feeling this way, to reach out, certainly. And this is such a great resource Overlake has. I'm so grateful. How can people learn more about this?
Absolutely. So for patients of Overlake, you can go to our website, to the Childbirth Center website, and get a little bit more information. And for parents who are outside of Overlake who are seeking care, a great resource through Washington State's Perinatal Support Washington, and I think we'll have their warm lineup shortly. But you can go to our website if you're a patient at Overlake to kind of get a little bit more information about the services we offer. We're really, we really want people to know that they are not alone in this, and there are a range of options available to really change the trajectory for their health and for baby's health.
Oh, bless you. Bless you, Marissa, and everyone who is working for this. Thank you so much for everything you've shared with us today.
Well, thank you for having me.
Of course, anytime you are welcome here. And to get more information about perinatal mental health services at Overlake Medical Center, please just visit the website on your screen. My friends, reach out. Don't be quiet.
This portion of New Day Northwest is sponsored by Overlake Medical Center.